Welcome to the evolution of the CHW Hub within public health. My name is Merlene Tucker, and I'll be running today's web forum along with my colleague Jeff Bornstein. Today's web forum is sponsored by Workforce Pathways for the Public's Health, a program of PHI Center for Health, Leadership, and Impact, and produced by Dialogue for Health. Moderator of today's event, Dr. Carmen Rita Nevadas. Carmen is a senior advisor at the PHI Center for Health, Leadership, and Impact, founder of Dialogue for Health, and senior vice president emeritus of External Relations and Preventive Medicine at the Public Health Institute. Welcome, Carmen.
Thank you so much, Merlene. Welcome, everybody. This is a really exciting moment for us at Dialogue for Health. This is going to be a great web forum, and we are so happy to have you here sharing this information, this opportunity with us. There's lots of excitement and promise with some of the new regulations and opportunities provided for integrating community health workers into core local health department work. Today, we're going to be looking at how one local health department stepped up to the plate, provided leadership, fostered innovation, and strengthened local partnerships while they were developing their community health worker hub. Let me start by giving you a brief overview of the PHI Center for Health Leadership and Impact and the Public Health Infrastructure Grant. The CHLI's mission is to advance health and equity by increasing the capacity of individuals and teams to transcend boundaries, work collaboratively, and transform their communities. Our programs help teams and individuals build healthy, more equitable communities by developing multi-sector partnerships and leveraging local resources. Public Health Infrastructure Grant is a groundbreaking federal investment in the U.S. public health system that helps to ensure that every U.S. community has the people, services, and systems needed to promote and protect health. Through three national partners, the National Network of Public Health Institutes, NNPHI, the Public Health Accreditation Board, FAB, and the Association of State and Territorial Health Officials, ASTO, governmental health departments have access to training and technical assistance to address infrastructure needs within their departments. CHLI is proud to serve as a key partner for HHS Region 9 public health departments across California, Arizona, Nevada, Hawaii, and the U.S. Pacific Islands through NNPHI. In this capacity, we support training and technical assistance needs around workforce and their department foundational capabilities to address long-standing public health infrastructure needs. Next slide. So we have an excellent presentation for you today titled The Evolution of the CHW Hub Within Public Health. By the end of this webinar, attendees will learn how to build and sustain a revenue-generating program, learn how to leverage relationships with community-based organizations and other partners for successful recruitment efforts, understand the importance of building relationships with local managed care plans for assistance and with program development. So now I'd like to introduce our presenters for today, joining us from Riverside University Health System, Public Health. Our first we've got Danielle Huntsman is going to be our first speaker. She's worked in public health for over 20 years and currently serves in the role of Deputy Director with Riverside University Health System over maternal child health, child, adolescent, and family health programs. She's a licensed clinical social worker and started her career working in HIV/STD services. In addition, Danielle has worked in acute hospital settings and has provided outpatient services to individuals with traumatic brain injury. She's an adjunct professor at Loma Linda University School of Social Work, where she teaches behavioral health integration and social work in public health. Her passion is to build systems that integrate and collaborate to ensure clients and their families have access to services. When not working, she's busy with her two teenagers at their sporting and social events and enjoying some peace whenever she can find it with her daily Starbucks. Next slide. Michelle King serves as a program director in injury prevention services with RUHS Public Health, where she oversees workforce and staff development programs. Michelle's responsibilities include a lead role in creating the RUHS PH Community Health Worker Hub. Additionally, she coordinates and leads all workforce development and workforce resiliency efforts, including grant management, consultation, and assistant on workforce development. Prior to working for public health, Michelle spent over 20 years working in education, including playing a key role in building the School of Continuing Studies at the University of Redlands in Redlands, California. Michelle received her bachelor's degree in political science and holds a master's degree in public administration. She's been married to her high school sweetheart for 35 years, has 3 children and 8 grandchildren. Next slide, please. Lucero Montoya serves as the Director of Operations with Riverside University Health System Public Health, where she oversees the daily operations of the Community Health Worker Program. She's dedicated to uplifting the community and addressing challenges in the healthcare system. Prior to working for public health, she worked with the RUHS Behavioral Health, implementing CalAIM initiatives such as enhanced care management and community supports for behavioral health and justice-involved populations. Lucero began her government career with San Bernardino County, where she was responsible for managing various homeless and housing grants under the county's Community Development and Housing Department. Lucero received her bachelor's degree in sociology from Cal State University, San Bernardino. She enjoys cycling, photography, and spending time with her family. And now I'm going to pass it over to Danielle to start our presentations.
All
Next
right.
slide.
Next slide. Thank you. Thank you so much, Carmen, for your warm introduction. And we are very excited to be here to talk about the evolution of the Community Health Worker Hub within public health. Just wanted to share a little bit about how we came to the decision to create a hub within Riverside County Public Health. And on the slide, you see Riverside University Health System, and I'll talk a little bit more about that in just a moment. But Riverside County Public Health is a part of a system. And so our system includes public health, it includes the medical center hospital, it includes behavioral health, and then it includes 11 FQHC clinics throughout Riverside County. And with all the work that public health has done through the years with community health workers, especially during the time of COVID, we have great partnerships with our community-based organizations. We wanted to leverage that. And as we talked with other parties within our system, we all agreed that public health would be the best place to have the Community Health Worker Hub. And Michelle and Lucero will get into more detail about that. But basically what the hub is, it's a centralized location for referrals and for billing, and to really coordinate services. So there's a continuum of care within our system, but also within the community. And again, leveraging and working in partnership with our community-based organizations. So just wanted to lay that ground as we dive into the presentation. So thank you so much for being here with us. I often say we are writing the book with all of you. We are learning every day about community health workers and how to build the hub, how to build a strong hub that's sustainable, how to do the billing, how to do all the operational pieces that come with working with the community health worker benefit. So thank you again, and we're excited to share with you, but also hear your questions and again, build this together and write this book with you. So I will go ahead and turn it over to Michelle King, our program director for the Community Health Worker Hub. Next slide.
Thank you, Danielle. Next slide, please. Just to give everybody a little bit of context about Riverside County, we are the 4th largest county in California in terms of area and population. We are the 10th most populous county in US. We have over 2.4 million constituents, patients, clients in our area, in our county, and we are the 2nd fastest growing county in the United States. Next slide, please. So just a little bit about, Danielle was sharing a little bit about why we started the hub. You know, a lot of us that have been working in public health know that about 80% of all of the work that we do in public health is traditionally grant funded. And we're coming up on some of our grants that are being sunsetting on a continuous basis because we're starting some, we're ending some. And so there's always that issue of where the next funding is going to be coming from. In 2022, the Medicaid expansion and the APL, the All Plan letter from Department of Healthcare Services came out, where they identified newly covered Medicaid benefits, which included doulas, community health workers, and peer support. And of course, when we think about healthy people 2030, we know that there is a very big emphasis in the CDC and in public health in general regarding health equity and the social determinants of health. So those were some of the key areas that helped us to decide on how we were going to focus on CHWs. Next slide, please. So when we talk about social determinants of health, for those of us in public health, this is not something new. This is something that we all recognize. Those social determinants of health are those barriers that individuals face every day, some folks, that really impede them from living the healthy life that they're intended to live. And so we, through work with the CHWs, are learning how we can look at those social determinants of health and provide resources to really assist patients. The CHWs come to us with a lived experience, and often those lived experiences directly are what helps the CHW connect to their patients and their clients that they're working with every day. They also help to facilitate access to services by doing a lot of resource navigation and connecting folks to other providers to help them continue with their healthcare. They serve as liaisons between their healthcare professionals and community members, because oftentimes when we hear a lot from our patients is that they don't necessarily know how to have certain conversations with their providers, but by building those relationships with their community health workers and building the trust between them, it really starts to open things up, where they start to peel the layers away. And then the community health workers are really able to then share that information with healthcare providers. And that then helps with overall the improving the health outcomes of our county folks here, our constituents, our clients. Next slide, please. So some of the strategic initiatives when we first went about building the Community Health Worker Hub was we talked about wanting to empower communities so that they can make healthy choices and actions. And we do that by providing resource navigation to community members to help them to build the capacity. So one of our goals here in the Community Health Worker Hub is that we're really looking to help build the capacity of our patients, so that as we're able to assist them now, eventually when CHWs step back, folks gain skills and knowledge and information on how they can proceed and be their own best advocates. Next slide, please. So just kind of wanted to give a kind of a high level overview about what the hub is about. A little bit later on, Lucetta will be coming on and she'll be sharing a little bit more in depth about some really critical pieces of the hub. But one of the things that we did when we set out the model for our hub is we really used a lean methodology. We have some consultants that have been here with us in Riverside Public Health for a couple of years now, and they've really helped us to focus and make sure that we're looking at what our charter is, what is our aim, what are our goals, what is in scope, what is out of scope, so that we could really focus on how we're building our hub. We collaborated with a number of different agencies, both internal to County Riverside Public Health and external, including a number of community-based organizations. We had them a seat at the table here at our events. We worked with clinic staff, the medical center staff. We also had First Five, Office of Aging, and just a number of different constituents who had interest and has the commitment to work with the CHW Hub model. Next slide, please. This is kind of one of the murals that we like to share, because we sort of want to give everybody a little bit of peek about what the work was like. It was actually very intense. We started off with our very first value stream event, and we spent about 4 days, I say locked up, but essentially, in a room together, bouncing ideas off of each other, really learning from one another. And this is kind of the mural that shows a little bit, a small peek into kind of the work that we did when we were organizing the hub and thinking about how this would work. Next slide. As Danielle mentioned, our UHS is made up of a number of different departments. And this is just kind of a visual for you to see that it does include the behavioral health unit, public health, our medical center hospital, and our community health centers. And really, the hub is intended to be the central location where we centralize a lot of our activities with the hub. Next slide, please. Some of those activities in our hub include our intake and assessment. So this is where we first get folks into our purview so that we can look and see what type of assessments we need. For example, we use the whole person health score as one of the tools that we use to identify those social determinants. We also are able to determine eligibility for services. We have our centralized EPIC EHR, which is our electronic health record. You know, in our past life, if you will, and previous to our current state, we were using multiple different platforms. We might be using SharePoint for some things, Excel for others, and EPIC for others. And what we've been able to do is we've been able to now build a central EHR system with a CHW component to it to serve as our one platform, if you will. Where we do get our documentation, we're able to do billing through there, and also our assessments, our whole person health score, for example, all live in Epic now. Here in the hub is where we develop our workflows and our processes so that we are able to identify standard work throughout the different deployment types. And then this way, anybody who's coming into our hub as a CHW can go into any of those environments and look at that standard work and have somewhere to take off from. We're able to send and receive referrals and partner engagement through our hub. So not only are we doing referrals throughout, for example, public health, or maybe we're referring somebody from the medical center to one of our clinics or public health, but we're also seeing referrals coming in and out through our partnerships with our multiple community and faith-based organizations here in Riverside County. So that's been a huge benefit as well. And then finally, we're monitoring here in the hub. We're looking to make sure that all of our CHWs are receiving their training, they're earning their certificates. We're able to track when they have to do their continuing education units. And these are some of the centralized services that we provide here in the hub. Next slide, please. So just a little bit about the work we've been doing with our community-based organizations. As I mentioned earlier, very early on, we invited them and we gave them a seat at the table. We realized that it was really important to make sure that, you know, because there's some things that public health does really well, and some things that our clinics and our med center do real well, but there's just some things that we can't do, and we really need our community-based organizations for those other areas. And so we partnered with some of our CBOs to be able to offer a certificate of completions. We're working with them very closely, and they are looking definitely at the kind of work that we and specific curriculum that we would need for our CHWs here in the county, and they're working with us on that. It was an opportunity for us to create documentation and billing pathways, because in our current state, while we are currently not offering opportunities for CBOs to use our EHR platform through Epic, that is something that in our future state that we are looking to implement, meaning we are currently working with one of our community-based organizations to have them pilot a program with them where they can potentially come in, use our Epic platform to do the documentation and do their billing. And this is a really great opportunity for them, some of the smaller CBOs that may not otherwise have the resources to build their own EHR platforms. And then finally, we're also working with our CBOs and our local health jurisdictions to be able to offer internship opportunities. So there are other organizations that are doing CHW curriculum and certificate opportunities, but at the end of it, the CHWs, before they can earn their certificate, they really need to earn some practical experience. So we're working on being able to offer opportunities for those CHW interns to do some work with the county. Next slide, please. And with that, I'm going to go ahead and I'm going to hand it over to Lucero, who's going to be talking to you about hiring and deployment. Thank you.
Hi, everyone. Thank you, Michelle, for the warm welcome. Next slide. The organizational and reporting structure of our CHW Hub is to deploy CHWs throughout the different regions in our county. The CHWs will be supported by a clinical supervisor overseeing a particular region of our county, and those 4 clinical supervisors will report to the operations director. There's also support staff that are vital to the success of our program, which are our office assistants, program coordinator, and health education assistants. Next slide. Our program staffing model is as follows. In year 1, it is projected to onboard a total of 26 CHWs and 4 clinical supervisors. Currently, we have a total of 10 CHWs employed, and our goal is to have the remaining 16 positions hired by January of 2025. By year 2 of this program, we aim to have a total of over 50 CHWs hired to support the needs of our community members within Riverside County. Next slide. What is also included within our hiring and onboarding process is our CHW training. Our CHWs go through a robust 1 month of onboarding. And within this 1 month of onboarding, week 1 is dedicated to reviewing and allowing the CHW to understand what is included within their scope of work. We also review the CHW core competencies and review the county's assessment that measures social determinants of health, which is known as the Whole Person Health Score Assessment. We also ensure that staff work through public health mandated trainings during this time frame. The remaining 3 weeks are dedicated to job shadowing, which provides an opportunity for the CHWs to shadow different programs within public health, our medical center, which is our county hospital, and a few of our community health centers. What is also included as part of onboarding is training of our electronic health record system, which here in Riverside County, we utilize Epic. Next slide, please. What is also provided is an opportunity for our CHWs to go through the certificate training program offered by our local CBOs as well as managed care plans. Though the DHCS's all plan letter states that the CHW has 18 months to obtain a CHW certificate of completion, it is our protocol here in Riverside County to have our CHWs enrolled in a training program within 6 months of employment so that they can obtain their full certificate of completion within the first year of employment. Next slide, please. After our CHWs are hired and have completed our month-long onboarding, they are deployed to different settings and departments within our county. Currently, we have CHWs supporting various programs within public health. We also have a few of our CHWs supporting our hospital, as well as our clinics throughout the county. We also have a few of our CHWs that are supporting our Department of Social Services, which is supporting a new county initiative referred to as Integrated Services Delivery. Our future staff spread includes partnering with county's probation department, fire and safety, as well as a few school districts within our county. Next slide. Epic and billing. Next slide. We have created a few templates within our electronic health record system to support the needs of the program. Our main template is documentation. This allows us to capture the date of service, the type of service that was provided, and the length of service as well. If you are looking to utilize an EHR system to capture the work that's being performed, we recommend to ensure that your EHR system of choice has easy accessibility that includes the ability to schedule appointments, that allows for patient registration, the ability to receive and send referrals as needed, and most importantly, that it has the ability to capture and submit billing within the same platform. This way, it eliminates the need to use multiple platforms for, say, documentation and billing. Next slide. Our recommendation for billing is to ensure that your agency and/or providers have a national provider identification number that includes a taxonomy code that's specific to the service that will be provided. We also encourage that they create a revenue cycle team to help track billing and revenue for your program. Most importantly, we encourage seeking partnerships with your local managed care plans. Here in Riverside County, we have partnered with Inland Empire Health Plan, which is the Inland Empire's largest managed care plan, who has agreed to reimburse us for services at an increased rate. We do plan to contract with a couple more managed care plans by the end of 2025. Next slide, please. Within our EHR system, we've been able to create what we have here, which is a Power BI dashboard that extracts real-time data from our EHR system. And this really helps us track productivity per CHW, as well as productivity per site, in addition to number of referrals submitted by providers within our network. Next slide. Thus far, we've been successful in sustaining our program by leveraging dollars from state and federal grants, agreements with our local managed care plans, as well as agreements with county departments, which have assisted with our CHW staffing cost. Currently, our CDC infrastructure grant is funding the majority of our CHW salaries and benefits, as well as our operations while we wait to receive reimbursement for services provided. Our goal is to help build our CHW's capacity so services can be billed and the position can then become self-sustained. Once the position is self-sustained, it allows us to backfill and bring on additional staff as needed. What has also helped the sustainability of our program is partnering with managed care plans who have agreed to reimburse services at an increased rate. Next slide. Now, this is some of our program outcomes. Next slide. Within about 6 months of launching our program, we've had some successful accomplishments. We've been able to deploy our Epic EHR system in 3 phases, which concluded in June. So far, we have been successful in submitting 2 test claims to our managed care plan, which is IHP. And we have just about over 3,000 billing encounters in our queue waiting for submission. We've been successful in assisting over 2,000 residents within the last 6 months. Some of our lessons learned is Epic engagement, and this is regarding our participation or a lot more involvement with our EHR system and informatics team. One of the lessons learned as well is organizational readiness for the receiving sites that will have CHWs. And we also learned that it's very important to incorporate our frontline staff in a lot of the decision making that we have, and just allowing them to have a seat at the table and provide, any feedback that they might have. Next slide, please. And lastly, before I conclude, I'd like to share with you all some of the biggest milestones that we've been able to accomplish within the last 6 months. In October of 2023, our CHW job classification was approved by our Board of Supervisors. In February of this year, our Board of Supervisors approved our managed care plan agreement with IHP. In March, we hired our first cohort of CHWs along with our clinical supervisor. In April of this year, our CHW documentation went live in our electronic health record system, which is Epic. And in May, our CHW billing template went live in Epic. And then within that same month of May, we were able to finalize standard work throughout the different settings in which our CHWs are deployed. And lastly, in the month of August, we submitted our first test claims to IHP. Next slide. And that concludes our presentation for today. We'd like to thank you all for joining us. And we'll go ahead and open the floor for any questions or comments.
Wow. Well, thank you so much. I think you have covered so much material and you're getting lots of love from your audience. And that's wonderful. Really good questions that are coming out here. I want to just ask everybody, we like the comments that you're making and really like the questions. So please keep them coming. It's really it really helps make this a rich discussion. So there's a lot of questions about CHW training and certification. I think partially, I'm going to ask you to just go back over that a little bit and talk about whether you're accepting people who are certified from other institutions, whether you require that you have to have all of the people go through your own certification program. I mean, how do you decide what is enough training, and how many languages are you able to serve, and in what languages are training programs available?
All right. Well, I'm gonna look to Michelle and Lucero, who are experts on this. So, Michelle, do you want to go ahead and start?
Sure. So what we're doing so what we did was, when we did our job descriptions, we have two levels. We have a CHW1 that does not require the certificate, and the CHW2 that allows you to come in with your certificate. If you're coming into this position without having earned your certificate, we require you to do that within the first year. And as I mentioned earlier, we've actually contracted with some of our local CBOs to be able to provide that training for them. So it requires a certificate. Now, we do sometimes have folks that have come in and they already have their certificate. We don't have any specific standard in terms of it has to be from a particular location. As long as you can prove that you've earned a certificate, then you're eligible. And then, of course, here the APL, the all plan letter, tells us that once a participant has, or a candidate has earned their certificate, every year they have to earn an additional 6 CEUs. So we monitor all of that here locally in our hub. We're making sure that everybody has their certificate. If you don't have it already, we're sending you, and that is a cost that is absorbed by the county. We send you during work time to earn your certificate, and then we make sure that you're getting your CEUs each year. Did I answer all the questions there?
Maybe languages?
Oh, right now, primarily Spanish and English. You know, in Riverside County, about 51% of all of our constituents in Riverside County are Hispanic, and Spanish is the primary language spoken. So that is primarily, when we are hiring, we're looking for Spanish speakers in certain deployments because they've asked us for that. We do also have language services here in the county in public health. So whenever we come across a client or a patient that needs other languages, even whether it's ASL or it's Mandarin, other things, we have services that can provide translation for those clients on an as needed basis.
That's really useful. I'm going to ask a question that wasn't asked by the audience, but I think maybe is cooking in some people's minds. How challenging was it for you to develop this classification working with your HR department? And I noticed that your board of supervisors approval came in the very recent past. I'm wondering if you had any challenges in getting your governing body to accept the idea of bringing community health workers in.
I'll go ahead and take that question. So, to create the 2 job classifications, it took about 8 months working with HR. I will say that our board of supervisors very supportive, HR very supportive. It was a lot of, class and comp, comparing our job classification and pay rates with local counties, local CBOs. We also brought in our local CBOs as we were creating the job classification, because we wanted to be in line with what they had for their job classification as well as pay rate. We didn't want to be in competition with our CBOs. We wanted to be in partnership with our CBOs as we created that. So, for those of you that work in government, we know it takes time, but it was about 8 months to get that through, and it was definitely a celebration when that did get approved.
It's quite remarkable. I'm impressed with your short timeline. I know it probably felt like an age, but that's a remarkable timeline.
Yeah.
So congratulations.
Yeah. Carmen, I did just want to jump back really quick to the training question. We talked a lot about one of our managed care plans, Inland Empire Health Plan, which have been a fantastic partner with us. They have a community health worker program as well, and they also have a training program and certification program. So they have opened that up to the community health workers that we have hired. So we're able to also utilize them as a resource for training for the CHW certification.
That's really helpful. I things that really help to build those relationships across the other institutions around you are just so key to making this type of innovation work. I'm going to switch a little bit and talk about your EHR, because I think that can be a real stumbling block to make sure that you have a system that meets as many of your needs as possible. So just run through that really quickly again, and underscore how you're using it to do your billing and your workflow management, and also how it supports information sharing, such as referrals and making sure that everybody's on the same page as to the basics of the clients that you're serving.
Thank you. I'll go ahead and start, but I'm also going to tap on Lucero because I know she has a lot of expertise in that area as well. I can tell you that we started working with them over in Epic over a year ago, and we really started with the basics. As I mentioned earlier, one of the things that we were doing is we were using multiple platforms, right? So you might have somebody in a clinic and keeping all of this, documentation in a SharePoint site, a secured SharePoint site. And then you might have some other folks using Access, or using Excel, different platforms. And so what we decided, we were using Laserfish or different programs for our whole person health score assessment. We were using Qualtrics, multiple different platforms. And what we identified very early on is we needed to consolidate everything in one place, because we knew that we really wanted to be able to harness this reimbursement model and this billing a capability that we now have because of the all plan letter that we received. So what we did was we started working with Loma Linda, who is managing the Epic platform for us, and we created our own platform, we call it our, what do we call it? It's our module for CHW. It's our CHW module. So what we built into it was everything from the referral order. So you can directly send the referral order in, the provider does the referral order. We can then deploy it to the CHW. The CHW can do all of the assessments online in Epic. We can document in there. So we're keeping all of our SOAP notes, and we're doing chart scrubbing and making sure that we're documenting everything about the encounter that we're doing every time that we're meeting with a patient. And then all of that is able to then go into the billing work queue. So again, and Lucero, you might have some additional information on that, but essentially it's a centralized place where we have all of the documentation and assessments and billing happen in one place. So it's really making things much more easy and streamlining the process when we're getting those bills over, and we have to share information about plan of care with the managed care plan and all that other stuff. Lucero, maybe there's some additional context that you could provide.
It was beautifully said. Thank you, Michelle. But what I would like to add to that is it's been actually a really great feature for us, because some of our residents may walk through, let's say, the ED, or they may walk through the hospital. Their information will be available, let's say, the following week if they go to see a CHW at the clinic. The CHW at the clinic can see the information because they've been able to, enter through the hospital, which also uses Epic. The clinics use Epic. Public health uses Epic. Currently, our behavioral health department does not use Epic. However, they are moving into that direction. So that's been very helpful for us, is to have that centralized location. What also has been helpful too is the billing piece. A lot of the information, actually all of it, populates onto the CMS 1500 form, which is the acceptable form for the managed care plans when it comes to billing. And that automatically pre-populates all of the information and submits it on its own through a clearinghouse. And then the managed care plan receives the bill or the claim through their own clearinghouse. So that has been vital in streamlining the process for us.
This is really excellent information. We are getting so many very, very good questions. One of the things that I'd like you to do is to talk a little bit about how, I think maybe people don't know both how urban Riverside County is and how rural Riverside County is. And I wonder if you might talk a little bit about how are you currently, and what do you foresee as the way in which you are using community health workers in the ideal situation in both the more city bound and the more rural. So give us an idea of what that looks like and what the contrast looks like.
Well, Danielle, do you want to start with that?
Sure. So, Michelle, I know you covered some of the demographics for Riverside County. But again, 2.5 million and, one of the largest counties in the nation. So it is very diverse in terms of urban and rural. This is where I think it's so important, Michelle, and you'll talk about this, about, we have our community health workers within the hub, but this is why it's so important to have the community health workers with our community-based organizations. We work with a lot of community-based organizations that are in rural territories that are able to reach populations that we may not be able to reach, that speak languages that we may not have the resources for within our current staffing. So it is very diverse and very large. And for those of you that are familiar with Riverside County, we go all the way to the border of Arizona. So lots of territory to cover. So I'll pause there, and I know you have more to add to that, Michelle.
Yeah, I just wanted to give you an example. So we do have multiple CHWs that are in various different deployments, as we mentioned earlier. And one of the benefits of having them come through the hub is that we've centralized the onboarding, making sure that everybody understands the scope of work and making sure that they're all using the standard work. But let's just say, for example, we have folks here in our medical center, which is very urban, right? But then we've got folks all the way out there in Blythe, like Danielle said, it's just bordering Arizona, and it's very urban out there. And so, or maybe rural is what I really want to say. And so it's very difficult to find staffing out there. So we have been able to staff out in the Blythe area, for example, and we will work very closely with our CBOs, like Danielle mentioned, because it's really important. We just don't have everything internal to the county. We sometimes have to use our CBOs and utilize some of the benefits and the services that they have as well. So we do realize that we have all different populations here in Riverside County, and we're doing the best that we can to spread. And we do have a spread model that we've been working with. Right now, we currently have 10 CHWs, but we're definitely looking to more than double in the next several months, and we will continue to spread to those other outlier areas.
And Michelle, if I can just tag on to that, and I know Lucero mentioned this as well. We are working closely with our other county agencies to integrate community health workers into areas of Department of Social Services, into probation. So again, we're trying to integrate into different entities within Riverside County and across Riverside County as we spread over time.
Yes. Including we have, here in Riverside County, we're using the integrated services delivery model as well. And so we've also been able to have some CHWs placed there and working with family resource centers. And so we're definitely using beyond just the public health model, but we're using the ISD model, we're using the family resources model. And that is really helping to support the CHW work that we are doing.
That's really helpful. Those are some really great answers. And I think that you've got a lot of clearly there's a lot of ground to cover here. And I know it's a very complicated county with lots of different terrain that you are traversing. Partnerships are really essential to this. Before I get into a deeper conversation about partnerships, I want to ask some questions about how do you keep this sustainable? And let me just ask, there are different billing systems that you all are using. And so I just want to know how how sustainable do you think the health plan sees community health workers to be going in their future, and with your county as well, but also with your community partners? What's your vision around that? What are you hearing back from your partners?
So I'll start by talking about the work that we've done with the health plans. And I know everybody has different relationships with health plans. I will say, and we've said this before, Riverside County, we have a great partnership with Inland Empire Health Plan, as well as Molina is our other health plan. And we're, venturing down that road to get a contract with Molina in addition to IHP. As I share that with you, as we've entered in these conversations, we've had to be very realistic in terms of here's what we're trying to build, here's how much it's going to cost, and we need your support. And the health plans have been very supportive, as Lucero mentioned, in helping us reach our need, helping us with building the infrastructure. Michelle talked a lot about the Epic electronic health record piece. There's a lot of resources and funding that goes into that. And, the health plans have been extremely supportive and understanding in terms of what it takes to build something like this. The community health workers and the hub will far outlive, many of us, and that's what we want. We want to take everything that we've done within public health with community health workers and our CBOs, and we want it to live on. And we want to create a very solid foundation of sustainability. So Michelle, I'll pause there and let you and Lucero talk about some of the safety funding grants that we've used.
Sure. So really what we did was when we started building this hub, we really were looking at a sustainability model. In other words, how do we leverage the current funding that we have to help us build it to then make it sure that it's going to be sustainable beyond that funding? Because as we talked about early on, a lot of these grants sunset, and then oftentimes what happens is staffing gets depleted, programs get depleted because there's not sufficient funding. So what we did was we used some of our FIG dollars to hire some of the positions to help us build our infrastructure, help build some of the positions, including some of our CHWs. And then what happens is as soon as we're able to realize that revenue that we're currently working on doing is once we start to see that revenue, then we can start pulling folks off of that secured funding and eventually backfill positions and spread. That's what our current model is. Let me tell you how we did that. We worked with our fiscal department and we were able to build a model, which is to say, if we had this many staff, and that includes everything from, clinical supervisors, operational supervisors, rev cycle staff, CHWs, how many encounters do we have to have every day in order to break even, essentially, right? So we built a model to say, we know what we have to do every day. And we work and we have these Power BI dashboards that help us to manage and track that on a regular basis. Another area that you can look to in addition to what Danielle shared about working with your managed care plans is looking at other county departments. Sometimes there are other county departments that can leverage the work that the CHWs are doing, and they may be willing to help say, we will provide funding for this many CHWs to get to help you with your spread, because we see the benefit in using them in our population as well. For example, the integrated services delivery model that we're doing. So they've also helped and they've, invested in our model. The most important thing is when we're looking at sustainability is to make sure that everybody has an understanding about what we're looking for and how many encounters, for example, and what that looks like so that we're all on the same page and we're working towards that and we're monitoring on a regular basis. Lucero, not sure if I left anything out, if you wanted to add something.
Yeah, I did. I did want to just touch a little bit more on managed care plans, and the success that we've had with regards to sustaining our program is those relationships that we have with our managed care plans. We were able to really show them how diverse our county is and show them the needs of our county. And so when we put our proposal together for our managed care plans, we outlined our county needs, and they were able to they agreed to reimburse us at an increased rate. Currently, there's a reimbursement rate released by DHCS, and our IHP was able to reimburse us at an increased rate. So my suggestion to you all would be to work with your managed care plans and advocate for the needs of your county or your community.
So I have the questions that we're getting from the audience are just so good, and I'm sorry we're not going to be able to answer all of them, but I want to go up a little bit and try to see if you can put together some answers around what exactly are your CHWs doing, and talk a little bit about the locations in which they're providing services, and whether they're doing after-hours services, and if there are any payer restrictions. That might take us up to the end of this presentation. So go ahead.
I can go ahead and get started, and then I'll go ahead and open the floor for Michelle and Danielle as well. But currently we have, just to start, I have a CHW who is supporting our public health program, our Riverside Overdose to Data Action Program. She works closely with a community-based organization that provides harm reduction strategies. And so she's doing great work out in the community. And then on the contrast, I have another CHW who is located in the hospital, and and she's providing services to the nursery. And so she is assisting and educating mothers on the importance of vaccines and the importance of ensuring that the child has appointments scheduled at the appropriate time frames and things of that nature. In the future, we will be getting a CHW to support the needs of the ED in the hospital. And so that's just a summary of where we have a couple of our CHWs. And I'm not sure, Michelle and Danielle, if you wanted to add a little bit more to that, but that's just kind of like a snapshot of our CHWs and how they are integrated within our county.
Yeah, I think, Lucera, we would love to have CHWs everywhere. So we're wanting to integrate them into all of our public health programs, all the 11 federally qualified health centers that we mentioned, as well as, I would love to see them on all the floors of the medical center and in every community. I do want to mention with the FQHCs, and because the hub is located within public health, this CHWs are deployed from public health, so we're able to put them in places like FQHCs, where FQHCs are not able to hire directly because they do receive the wraparound rate. So I just wanted to put that out there. But because we have CHWs under the hub, we're able to deploy them to different locations. So again, our system, we want to spread them everywhere within our system. And like we mentioned, our integrated service delivery work with other county programs like probation, Office on Aging, First Five, we're also wanting to spread to those sites as well. We're really working on focusing on the sustainability and the funding and the reimbursement to make sure that we're able to spread, but we want to be mindful of what that looks like. So we're trying to be very strategic as we build this and spread this.
And
So,
I apologize. I just wanted to
Michelle.
add really quickly. I wanted to say one of the other things is our managed care plans are also referring us when they identify patients with care gaps. They also refer them into the hub to deploy CHWs to them as well. So there are definitely many different areas and ways that we're able to deploy our CHWs.
So just a real quick question, because we only have about 45 seconds left for the answer. Do you provide training for your other health professionals so that you can really make sure that the respect and the full utilization and the practice boundaries are understood and really honored?
Absolutely. Organizational readiness is the name of our game. It's something that we identified very early on that it was critical. So anytime we were getting ready to deploy a CHW out to an organization, we spend a lot of time doing organizational readiness, making sure that they understand the scope of work, the delineation of duties, and making sure that we have even as simple as making sure that they have a specific space for their CHW when they arrive, that they have a place where they can sit and they have a location to do their documentation. It's all of those things, and we do a lot of work in organizational readiness to prepare them for that.
I can't say enough about how much you've packed into this and how many more questions are still out there. And so I just want to assure our audience that we are going to work to have a third in this series on community health workers. We think there's so much knowledge and really deep experience that's out there, and we'd like to make sure that this becomes a very successful program that everybody could start to implement. So I'm asking everyone, we're posting a link to a short survey, and we'd like you to complete that survey. And please know that your questions are not going to go unconsidered. We're going to try to figure out how we can use your questions to help our programming going forward. So thank you to everybody, particularly thank you to Riverside University Health Systems, to Michelle, to Danielle, to Luzetto for the great presentation you just did. It really was terrific. Thank you, and goodbye to everybody.